Let's start with a common situation. You are a parent. Maybe you have stopped going to family events. You avoid the supermarket. You feel nervous every time you step into a public place with your child. Why? Because you never know when the next tantrum will explode. People stare, you feel judged. You love your child deeply, but you feel embarrassed, frustrated, and lost. If this sounds familiar, please stay. This video is for you. Hi, I'm Dr. Katia Batista, a psychiatrist, and today I will walk you through tantrums in children, when they are normal, why they happen, when to worry, and how to manage them calmly and effectively. Then let's start. What are tantrums? Tantrums are emotional outbursts, crying, screaming, kicking, throwing things that often happens in toddlers when they cannot get what they want. They are not bad behavior. They are part of development. Why tantrums happens? Tantrums happen because of the frustration that creates the conflict between what they want and the limits imposed by the parents and caregivers, because of the brain is still developing. The emotional part, the amygdala, matures earlier than the rational part, the prefrontal cortex. Children can feel, but they cannot yet regulate their emotions. Language is limited. Toddlers cannot fully express what they feel, so they act it out. They cannot delay gratifications. Let's listen them now. Waiting is so painful. They seek control. Saying no or refusing help is part of developing independence. They don't understand limits yet, unfortunately. When tantrums are normal, when to worry. Normal tantrums happens between 1 or 2, 4 years old. Last under 5 minutes, and they are triggered by frustration, fatigue, hunger, and they will reduce with age. Sometimes tantrums go beyond what's expected for the child's age. Here are some red flags to look out for. The first one, speech delayed. If your child is not using any words by 18 months or not putting 2 words together by age 2, this could be a sign of delayed speech development. Children who cannot express themselves with words often get frustrated, and tantrums become their way of communicating. It's important to consult a pediatrician or a speech therapist if you are concerned. Second, social withdrawal. This means your child does not show interest in playing with others, does not respond their name, avoids eye contact, or prefers to be alone most of the time. Regression is when a child loses a skill they already have. For example, a child who was talking stops speaking. This is not typical and could point to emotional stress, trauma, or more important, like a developmental conditions. So let's talk about the conditions to watch for. Autism spectrum disorder is a developmental condition that affects social interaction, communication, and behavior. Children may show repetitive behaviors, speech delays, and difficulty with change. I explain these signs in more detail in my video on autism. Oppositional defiant disorder is other condition that is a behavioral disorder where children are constantly defiant, angry, easily annoyed, and often refuse to follow rules. This is more than just a strong-willed child. You will find, please, more details on this topic in one of my videos as well. Attention Deficit Hyperactivity Disorder, ADHD. Children with ADHD may have trouble sitting still, focusing, and controlling impulses. They may have frequent emotional outbursts that look like tantrums. Visit my video on ADHD for practical tics and signs. Other condition is sensory processing issues. Some children are oversensitive or undersensitive to sounds, lights, textures, or touch. A noisy supermarket or scratchy clothes can trigger big reactions. This is common in both autism and some children without a diagnosis yet. I'll be making a full video on sensory issues soon. Disrupted mood dysregulation disorder, DMDD. This condition involves chronic irritability and frequent intense tantrums beyond the age where they are typical. It's not just a bad mood, it seriously affects a child's ability to function at the school and home. And the last one to consider is post-traumatic stress disorder, PTSD in children. Yes, children can also experience trauma. PTSD may cause them to be more fearful, easily triggered, or show regressive behavior. Look out for nightmares, separation anxiety, or sudden aggression after a stressful event. If you please recognize any of these signs, it's important to talk to a healthcare professional. And don't forget, I have full videos on many of these conditions on my channel, so feel free to explore and learn more. Let's talk about how to handle tantrums at home. Let's be honest, tantrums are tough, but how you respond as a parent really makes the difference. First, it's important to know that not every behavior during a tantrum deserves attention. Sometimes ignoring certain outbursts can be more powerful than reacting. Choose your battle wisely. Don't try to reason during the tantrum. In that moment, your child is overwhelmed. Try to give long explanation. You know, you should not be doing this because won't work. They are not in a state to process logic. Save the teaching moment for when they have calmed down. Stay calm. Your calm energy helps your child find theirs. Use a simple, clear voice. No need to yell or argue. You are modeling emotional control. Remember that. Stick to your boundaries. If you have said no, keep it. Don't give in just to stop the tantrum. Giving them what they want during a tantrum teaches that yelling or crying works, and you will likely see more of it. Anticipate triggers. If you know your child is tired, hungry, or overwhelmed, it might not be the best time for a long errand or crowded space. A little planning goes a long way. Use praise. When your child does calm down or expresses frustration in a healthy way, acknowledge it. I noticed you were upset and took a deep breath. That was amazing. Reinforce routines and consistencies. Kids feel safer when they know what to expect. Clear routines reduce frustration and outbursts. Remember, tantrums are normal in early childhood, but how you handle them teaches long-term emotional regulation. Tantrums can be exhausting and hard to manage, but they won't last forever. But if you notice the warning signs I mentioned earlier, like tantrums continuing beyond the expected age, delayed speech, social withdrawal, or regression, don't wait. It's important to seek help from a mental health professional for early diagnosis and support. If you found this video helpful, please subscribe, like, and share. Also, drop a comment below and tell me, how have you managed tantrums with your child? What strategies work for you? Your experience might be just what another parent needs to hear. Thank you for watching and take care.